The decision for bariatric surgery, always difficult, but what are your options? You have mostly 3 options that are available, and here at CGA we do these 3 options. The first, and now honestly the most popular option, is something we call the sleeve gastrectomy, or as it's popularly called, the gastric sleeve. Here we create a much smaller stomach. About 80% of your stomach is actually removed, leaving a small sliver, or if you want to think about it, a sleeve of stomach, such that you're able to eat less food and you feel full much quicker. The other good thing about this procedure is that the part of the stomach that's removed produces a hormone that makes you feel hungry. So once that part of the stomach is removed, you don't have as much of a drive to eat as you would have before your surgery. Another option is the gastric bypass. Of all the surgeries that we do for weight loss, this is the oldest of all of them, and it's the one that's been most extensively studied. With this surgery, 2 things occur. First of all, we reduce the size of the stomach, and then we do the actual bypass, which involves bypassing a portion of the stomach as well as the earlier portion of the small bowel. And then we hook the small bowel up at a lower point such that the actual length of bowel that your body has to digest and absorb food is significantly reduced, and this helps you to lose weight. Now with this surgery, it is a bit more involving, but we do have really good results. For patients who are significantly diabetic, that's patients who are specifically on a lot of medications for diabetes, it is actually the surgery of choice, especially if you're not in the very overweight category, where BMI is less than 50-55. The third operation is called the Duodenal Switch. Now of all the surgeries, this is the most intricate, as well as the one that you do expect to have the most weight loss for. With this surgery, you can lose up to 200 pounds, and it involves a combination of both the sleeve gastrectomy and the gastric bypass. That's an easier way to think about it. With this, we do a sleeve of the stomach, which reduces the size of the stomach, and then we do an intestinal bypass, where we bypass part of the small bowel. Now, with the duodenal switch, the bypass that's done is much longer, so you have a much shorter length of small bowel for digesting and absorbing food. With all of these procedures, you will have weight loss. And with each one, it depends on how much weight you need to lose, also depends on some of your associated comorbidities. And here at CGA Weight Loss, we would not do a one-size-fits-all. We settle down and talk to you to find out what your aspirations are, what your goals are, what's your drive behind seeking bariatric surgery, and what your other medical problems are before we decide what is the best surgical option for you. The journey is a long one, but we're going to be here with you throughout the way. What we do is help you win this battle by losing your weight.